Good morning, everyone. My name is Kim Russell. I have the pleasure of being the chair of the board of the Community Health Endowment, and I'm also president and CEO of Bryan Health. I'd like to welcome you all here, first of all, to these beautiful offices of Community Health Endowment for really a grand occasion today. I have a number of people that I would like to introduce to the audience before I give you a little bit of background. Joining me at the podium and speaking a little bit later, Lori Seibel, the president and CEO of Community Health Endowment. Our own Mayor Chris Beitler will be joining me at the podium in a moment. Carl Eskridge, Lincoln City Council, is here as well. Carrie Kernan, Chief Operating Officer of the Health 360 Clinic, is here. Brad Meyer, new to our community, President and CEO of People's Health Center, and also Judy Halstead, the Health Director, Lincoln Lancaster County. All will be speaking and sharing a part of the story. There's a few others in the audience that I'd like to introduce as well. The Community Health Endowment, as probably most of you know, is guided by a board of trustees, and we have excellent representation from our board of trustees today. Dr. Chuck Wilson is here, Dr. Mike Mulvar. Judy is also a member of our board of trustees. Lauren Roberts is here. And we also have Britt Miller, who served many years on our board of trustees, and unfortunately, his term limits ended just recently, but he's been so involved in this project. Really glad that Britt could be here today. I'd also like to welcome Ruth Henricks in the audience, the president of Lutheran Family Services. Ruth, thank you so much. This wouldn't be happening without your leadership. And also so very glad to see City Councilwoman Lyrian Gaylor-Baird here as well. So lots of great folks in the audience. Hopefully they'll all be able to answer the questions that I'll need some help with. But you know, as I walked into the building today, you could really feel kind of an energy and a vibe going on. And I think that's because of the great excitement about our announcement this morning. I still consider myself kind of a newcomer to Lincoln. I've only been here about 7 or so years, which isn't very long compared to most of you. But what's so unique about this community is its ability to come together to solve a problem, tackle a complex issue, and to do that in a way involving multiple partners and multiple parties. And that's exactly what our situation is here today. Mayor Beitler, who I like to think of as the healthcare mayor, I first got to know Mayor Beitler when I moved to Lincoln, and he asked me to chair a blue ribbon task force and on the safety net, the healthcare safety net. And the group worked together very hard for many months, and one of the key recommendations coming out of that task force was the fact that Lincoln needed to add to our capacity for medical homes. And our community in that period of time has made a lot of progress. A lot of organizations have helped with that. But today's announcement will bring us that much closer to establishing a medical home for every individual in our community. So today we're very pleased to announce the creation of Health 360, which is a new clinic that will be located in the heart of Lincoln, actually very close to where we are today. The clinic will be located at 2300 O Street. It is called Health 360 because it really represents how the clinic wraps services around each patient. And our services are special and unique because it's what we call the fully integrated approach to healthcare, in which we'll be providing both physical health services as well as mental health services, all in the same location in a team concept of care. So creating a clinic of this nature, especially in today's complex healthcare environment, is no easy task. And that's why I'm so very proud of the many partners that have come together to make this happen. Today's announcement is the culmination of months and months of planning. All of the leaders in healthcare in our community have been involved. Bryan Health, CHI St. Elizabeth has been an extremely important partner. Our City County Public Health Department, People's Health Center, obviously Lutheran Family Services, Community Health Endowment has served as the catalyst for today's action, and many, many others. So you're seeing the result today, the product of all of that work, and that's why we're so excited to bring this concept out to the public and to speak about it today. So at this point, I'd like to bring Mayor, actually I think I'm going to bring Lori up next. Lori up to the podium, and Lori can fill us in on a couple more of the details. Lori.
Thank you, Kim. Well, here we are. What a journey this has been, and I'm deeply grateful to every face that I see in the audience today for making this happen. Some of you are learning about this project today for the very first time. Some of you have been around the table for a year, some of you for 5 years as we've talked about this. But I have a bit of a confession to make to you today, because for me this journey is probably about 25 years, and I'll tell you why. When my first job happened to be in an organization or in a building that had both a community mental health center and a primary care clinic. We were both located in the same building. And at that particular time, 25 years ago, we often talked about how we could more clearly separate those two organizations. Because after all, they were very separate patients in our minds. They were separately billed. They were seen by different kinds of providers. They had a different kind of room. They had a different kind of follow-up care that was needed. And so they were indeed, in our minds, two separate, entirely separate organizations. One was treating the body, and one was treating the mind. And in all the conversations, this is the interesting part, in all of those conversations that were happening at that time about these two clinics and how we were going to manage this, no one ever argued the point that they should stay together. The argument was always that they should separate. And nobody told us that separating them was a really bad idea. It's just not how people thought at that particular point. Well, I will tell you, probably about fast forward 15 years, and some real startling data started to come into play. And among the most startling was that individuals who are living with mental illness have a lifespan that is 25 years shorter than people who don't. Think about that. That's a lost generation for these individuals. They were dying 25 years younger. And so the Mayor's Task Force on the Healthcare Safety Net that Kim alluded to, and many other planning efforts in the community, began to say what we now know is so clearly right, and that is that these services should not be separated from each other. In fact, they cannot be separated from each other in order to provide the best care. So about 5 years ago, a group of us began to have a conversation about how to create a place, how to create a clinic that fully integrated those services. And really, it was a conversation about how to put back together what we had taken apart. And so we wanted a place where a client, regardless of their ability to pay, could be seen without stigma, without walking into a door that had mental health clinic written above it, that they could walk into a place like that and receive care from a team of providers who understood the interconnectivity between the mind and the body. It has not been easy. Leadership has changed in the community. The Community Mental Health Center, in the middle of all of this, transitioned all of its services to local nonprofits. The Affordable Care Act came into play. Medicaid expansion is still a question for our community. The conversations were hard. There were hard conversations about money. There was hard conversations about models. There was hard conversations about locations. But you know what? In the middle of all of that, nobody ever said, this is a bad idea. Everyone said, this needs to happen, and this needs to happen for Lincoln. So like little engines, we all kept chugging along with the idea that eventually it would happen. So from a professional standpoint, I cannot be prouder to stand here today and tell you that I work for a board of trustees who has been steadfast in their support of this project and recently approved our largest grant in history to support the construction, renovation, and operation of this clinic. Now, from a personal standpoint, I also have to tell you now that I've confessed to you that my participation, whatever level I've had in the participation of planning and implementing this project, really allows me to make a little bit of amends to the community for not seeing 25 years ago what we so clearly see today. So thank you for allowing me to make those amends to the community. So I'm grateful to all of you, many of them mentioned by Kim, but I'm particularly also grateful to the mayor, and I would like to introduce him now. In doing so, I want to express to him my thanks for for not wavering in his support of this project and his determination to get it done. But I'm especially glad and appreciative that he trusted me when I told him that this day would come.
Well, she referred to me as the healthcare mayor, and I was quickly relieved to find out that wasn't some reference to my exorbitant use of healthcare resources in the community or something, because I was feeling pretty good. But I am so delighted to be here this morning, as I hope all of you are. This has been a long day coming, but this step is going to put us right up there in the forefront of progressive communities in this country. And I don't know how I got there. I got there probably through Lori's urging, but finding a medical home for everybody has been a big item for us in city government. We want everybody to have a medical home, and that we think is a proven way to reduce healthcare costs and to have healthier children and healthier people, a healthier community. Just yesterday in the evening, I was over at Elliott School, and the second graders and the third graders had a project, and the fourth and fifth graders had a project that they were explaining to us, and it all had to do with what the community needed. And they wanted the mayor there so I could hear what the community needed. And they had spent several weeks on it, and they had discarded things like skate parks and swimming pools, and really came down to some interesting kinds of conclusions that were really very adult-like in terms of the things they identified. And all that signified to me, most of all, that here are these children, a lot of them clearly low-income children, minority children, just with loads of intelligence and energy. And when you think about what the city needs, how much we need them, what's fair to them too, and when you recognize that health is one of the big stoppers from the infusion of this energy and intelligence into the community, then you begin to realize and think again about the importance of this project. So I love the fact that it's focusing on the whole person, as Lori has described. I certainly want to thank Lutheran Family Services for coming into this process and being a major factor in making it all come together. The People's Health Center, of course, is central to it all in terms of collaboration, in terms of bringing additional financial resources to the effort. The clinic, of course, is not about making money. The focus is to provide quality services to improve health care for all patients who use the clinic. And by partnering with the People's Health Center, of course, we have access, hopefully, to additional federal funding. I also want to recognize the highly effective work of the Community Health Endowment, not just on this effort, but on many efforts in this community. What a unique and great institution. I don't know who thought of that, but it was a great thought way back then before I was around. And Community Health Endowment is taking yet another huge step with this, of course, in making Lincoln, as it likes to say from time to time, and truly means, and I think will truly get to be the healthiest community in the nation. So the endowment funds are helping to renovate the old Office Max store with clinic space, and also I think providing some of the operational costs up front for the operation. So that's great. So again, in closing, I think I just want to thank everybody for one more terrific Lincoln partnership that has worked hard for an extended period of time now to bring this about, but nobody gave up. Everybody tirelessly regrouped, and finally, I think we're making this work. And the final blessing, I guess, is that here at the tail end of the process, we have a couple of developers from Apple's Way who are also bending to make things better for the community. So, thank you very much. Congratulations.
Carl Eskridge, it's my great pleasure to work with this guy on a regular basis. I represent central part of town and the northwest part of town, a very varied district that includes some of the poorest people of our community. And so I'm really grateful for this important project. The needs for both physical and mental health treatment are tremendously important in a community. When I'm not on city council, I'm also the deputy state ombudsman, and in that role encounter people that have all kinds of problems with the state of Nebraska and receiving state services, encounter people that have employment issues. You know, with regard to behavioral health issues, when you are not feeling well, when you are not performing well, things go downhill. Things can go downhill really rapidly. And so you can have problems on the job. You can have problems in your family. You can have problems with the law. I mean, things can really become very serious. And so by having this kind of facility to help treat people, to give people a place where they can go to resolve the issues that they face is so critically important to our community. You know, when you see this rendering of what the building may look like, and if we had a before shot, you would realize this is a tremendous transformation of a space. But think how that transforms people's lives. Think about the good that's going to be going on inside there. So we're going to hear more about that. Brad, you want to come tell us some? Okay. Okay. Yeah.
We'll have Carrie first and then Brad.
Okay.
Good morning. I'm Carrie Kernan. I am the Chief Operating Officer of the Health 360 Clinic, and I'm very proud to be partnering with Brad as we take on this endeavor to really make a positive impact on the health of the Lincoln community. I'm going to talk a little bit more details so you understand kind of operationalized what Health 360 is going to look like. We're going to be bringing the behavioral health expertise of Lutheran Family Services and working with Brad's Primary Care Excellence to really wrap those services around each and every individual client who come in through our doors. And Health 360, while it is a safety net for those most vulnerable, we are really there for everybody within the community. Lori mentioned a very astounding statistic, which unfortunately has been around for a number of years, in that those that are diagnosed with a severe mental illness do die about 25 years earlier than the general population. And there's a number of reasons, but for the most part, those individuals really are challenged with accessing and understanding how to navigate the healthcare system for basic medical services. We hear often from the clients that come in through services with Lutheran Family Services that they come in with minor injuries, illnesses, infections, or they're struggling just to manage even one, if not two, chronic diseases like hypertension, cardiovascular disease. And they tell us that they struggle with that piece of the physical health because they don't have a physician. They can't afford that physician visit. They don't have transportation. They're overwhelmed with the registration paperwork process. They are fearful of going sometimes to the physician for what they may hear, or they're so overwhelmed with just managing their mental health condition on a day-to-day basis that that's something that's not a priority that day. So as Brad and I work together with our staff, the primary care provider will be focusing on that physical component, the assessment, diagnosis, and treatment of those individuals, in conjunction, strong conjunction and partnership with our therapist. And then we'll also have the wraparound services from our registered nurse case managers that will be taking care of coordinating any specialty care, and really looking at that safety net component behind that individual. So do they need help with housing, transportation, utility, food, clothing, whatever that may be, so that it's a very coordinated, holistic approach. It's not just a siloed where we're looking at the physical and the mental without really connecting those two together. There are statistics out there that show that 25% of individuals that come in just for a primary care visit, if we really screen them carefully, have some component of a mental health concern such as depression, stress, or anxiety. So we really want to make sure that everybody that comes through our doors really get that holistic approach of everything that involves the mind and the body. So I'm looking forward to working with Brad as we really take a look at how we can move this model forward within the Lincoln community.
For those that aren't real familiar with integrated health, what it is it increases communication and collaboration between the providers and the patient. That's the point of integrated health. You know, we are working with LFS. We bring the primary care piece. They bring the behavioral health piece. Many of the patients that we see in primary care have dual diagnosis. They have, one or more complex health issues, but they also have some type of behavioral health, whether it's depression or stress. And our providers, right now, they have to refer those patients on. And we really don't know what happens after we refer them on. We make a phone call to LFS or one of the other providers in town, and we say, we got this patient, we want him to, be seen for depression. At that point, we're hoping that the patient follows up with that provider. In this situation, if the provider is in a room, identifies a patient that's in a crisis, potential crisis, or needs some help with coping skills, the medical provider can actually step out of the room, go to a therapist, and say, this is what I've got going on. Can you go and deal with them? The therapist then goes in and does a kind of a quick triage. Does the patient have good coping skills? Does the patient need advanced care? Or do they need help getting services that they're not currently on? That helps our medical providers because there's so many times that, there's a patient that really needs further attention, but we just don't have the time. So having that therapist pick up that piece is really going to be a benefit to not only the patient but our providers. And then the communication. The therapist is going to be using our electronic health record. So our providers are going to know what happened with that patient. And being in the same building as Lutheran Family Services, we're going to know if they went to a psychologist or if they went to a psychiatric nurse practitioner or whether they saw a psychiatrist. We're going to be able to follow that patient a lot more closely. We'll have a case manager, an RN case manager, who will be able to step in if the patient needs additional services, and be able to walk with that patient through the whole process, making sure they have better care. And that's what it's all about. And so when we talk about integrated health, that's what it is. It's following the patient, making sure they get the resources they need in a timely manner, and that's best served if you're in the same facility. So I appreciate everybody coming here. This is really exciting. This is the first time People's Health Center has expanded in its 11-year history. We're looking at more expansion opportunities in the future, and happy to be with LFS in this one. So thank you.
Good morning. I'm Judy Halstead. I'm the Health Director for Lincoln and Lancaster County, and I'm your closer, so I will be brief. I just wanted to reiterate some of the comments that were made so that folks have an understanding. This has gone on for so long, and so many folks have really felt like they've invested their life in this project, and for some people, they just walked in the door. And for both Carrie and Brad, who are out of state but new to Lincoln, who are so committed to this project, I'm sure for both of them, it feels like a little bit like an arranged marriage for Lutheran Family Services and for People's Health Center, because they walked into the middle of it and essentially were told, and here you go. And so we really, really appreciate their willingness to jump in with both feet and move forward, and their commitment to Lutheran Family Services, who really did a great expansion here in Lincoln when they were willing to take over the services provided by the county with the community mental health services, and both Ruth and Todd Reckling, who's the vice president, who's here, have really done a lot of this nitty-gritty work. And to them, we want to say thank you on behalf of the Lincoln's community in Lancaster County, because from our standpoint, obviously medical health or physical health is very important, but mental health is essential to wellness of our citizens. And so we really feel special about that. And then just to let you know, too, that we really appreciate Apple's Way. Both Bill Langdon and Benny McComb are here with us today. They have prime O Street property. It is abutting Antelope Valley. They certainly could have done many different things with the purchase of this building, and they probably could have made a heck of a lot more money than they're going to be making off of this initiative. But to both of those gentlemen, this project was very, very important to the health and the wellness of Lincoln, and they are both very committed to that. And so while we know they could have done everything differently with this building, we really appreciate the work that they're willing to have this clinic happen so that we can promote the health of Lincoln and Lancaster County citizens, and that we can make sure that the residents who live here get this great care. And in closing with that, I just want you to know that we really feel like this clinic is making the difference that will make a difference for a lifetime for the patients we serve. And many of you will go into your own doctor's office and know that your doctor may not ask you about how is your anxiety, or are you feeling depressed, how are you doing this time of year, and won't talk about the emotional health or the mental health. And this clinic will. And that is the difference that will make a difference for a lifetime. And so with that, I want to say thank you to everybody's work. And for the media, we will be opening up for questions now, but within your packet you have the artwork, you have all of the documents that we've been referencing on a flash drive as well. All of you can go to www.health360ne, standing for Nebraska.org. And so with that, we'd like to open up questions for the media.
Yes, go ahead.
Go ahead.
Do you know what the total project, total cost, or how much investment is being made by all the different, different groups?
Operationally?
Lori, you want to respond to that one?
And Bill and Benny, probably.
Yeah, Bill and Benny are going to.
Bill, do you want to come up, or Benny?
You guys know each other.
Bill? Come on up, Benny.
I've marked you, Benny.
That's why you wore the suit today, Benny. Benny McCombs.
Let's start first about talking about the Community Health Endowment investment. You want to talk about that, Lori?
Our total investment right now is $1.3 million, and a portion of that is going to help with the construction and renovation, about $500,000 of that. The rest of it will be going to help operationally. As you might expect, there's a time of getting this going, building up a client base, and it's simply a more expensive kind of care because of how much more integrated it is. And so we're going to do everything we can to make sure that it starts off on the right foot and that it has a good beginning here. You can talk about the building.
Morning, I'm Benny McCombs with Apples Way, and my partner Bill Langdon is hiding in the back. As far as the total investment in the project, from our perspective, it's a little hard to say because we're still in a flux. There is a question of a need to add a little onto the building. Whether or not we do or don't, we don't know that just yet. However, if we do the addition, we'll have a little over $5.3 million in the project when it's all said and done. If we don't, we'll have closer to 4.1. But our minimum investment is probably about 4.1 million.
Thank you. Next question. We'll take yours next.
Kevin.
Do you plan to seek tax increment financing, and if so, how much, and how would you use it?
The answer to that is yes, and I don't know. Because we honestly don't know we haven't finalized all of the design criteria yet for the building. It's kind of a unique building. It's specialized, as you can tell from this meeting, where you integrate healthcare and physician's care. Mr. Jeff Chadwick from Clark Anderson is back here, our architect. And we're close to having the final plan done, but we don't know, and so we don't know exactly what the final cost would be or what the request for TIF would be.
You talked about tapping into federal funds, to help pay for this on I guess a long period. I mean, how concerned are you about a new Congress coming in, maybe changing the rules, I guess, again, or how much do you need, I guess, expansion of Medicaid, to make the formulas work?
Right now, as a federally qualified health center, we receive a grant every year through HRSA, which is the Health Resources Services Administration, to provide care for those without insurance or those that are underinsured. Right now, we are subsidizing, CHE is subsidizing the providers for about the first 3 years, but otherwise, we're not at this point seeking any additional federal resources. We're going to try and make it sustainable through our encounters, through our current grant. There may be opportunities. There's a lot of integrated health home talk at the federal level. Right now, HRSA, for the 330B funding, which is where our grant comes from, has been funded through 2018. But of course, we all know with federal funding, you don't know, if that's going to come or go. But right now, we're not seeking any other federal funds. We're using it with our existing funds. And our goal is to make the clinic self-sustaining. But there may be a time where, we may have to try to seek out other funds, whether it's state or federal. But that's not in the cards right now.
I can just add, I think too, as we work within the community and we advance some of those relationships with our community partners, we will be utilizing a lot of the resources here locally as well, especially as we start the clinic and we really understand what some of those intricate needs are going to be. And so I think we're going to be, as Brad mentioned, the federal and state level. We'll also be working with some local partners to see what potential is there as well.
Carrie, you built the budget without expansion, so I think you might want to address that. You built the budget without Medicaid expansion.
True, we did. When we were working with Lori and the community partners, we built this original 3-year budget without Medicaid expansion. So we tried to build that buffer in, and we will be adjusting that budget every year along with Community Health Endowment as we look at the number of encounters, the revenue that's coming in through the door, the expenses, and then we will make those adjustments as there are changes to state legislature if we do get Medicaid expansion in the state of Nebraska.
How much would that help?
It would help. It would help a lot. I can't really give you a ballpark figure because I don't know what that's going to look like, and so I think it's going to help immensely. And we're going to have to readjust based on what that revenue cycle looks like.
Do you have any idea how many clients you'll have, patients?
We anticipate by the end of year 3 that we're going to be seeing around 20,000. As we open our doors January 12th, we'll be open for business January 12th. We'll be starting with 1 provider and 1 full-time therapist. As we end year 3, we're anticipating 3 full-time providers. And so between those 3 full-time providers and our therapist, we hope we're seeing around 20,000 people. Encounters, correct.
How does this help the whole community, not just maybe people who don't have access to health care now, or could use both the integrated services? How does this help everybody else in the community?
So the new building over at O Street, as well as our current South Street location, we operate our Lutheran Family Services operations out of that building, and we will be operating all of our other services out of that new site too on O Street. So in addition to the clinic operations, we will have ongoing behavioral health operations, our outpatient mental health therapy, our substance abuse, our medication management. So we will have all of the full supports of Lutheran Family Services in addition to the clinic operations. So I think that in conjunction with our RN case managers, we're also going to have an on-site full-time pharmacy with a full-time pharmacist. So I think that's where we're looking really at wrapping around services, and we're really going to working with those individual clients along with our case managers to link them to other resources that are in the community that maybe are not services that we offer directly.
Gary, do you want to clarify when the new building opens versus your services?
So the new building, the current location where we're at on South 17th Street, we will begin operations on January 12th. The renovations are currently ongoing. We'll have 3 exam rooms with 1 full-time provider, as I mentioned, and a full-time therapist. And then depending on the construction and working with Bill and Benny and the architect, we anticipate we could be in the new building as early as December 2015.
Other questions? Anybody have anything else?
Yeah, you know, Andrew, just to elaborate a little bit on your question, there are several very clear benefits. Looking at it in terms of societal benefit, there are several clear benefits to society here if you're going to get just purely selfish about it and not worry about fairness to the individuals. First of all, many people are going to the emergency rooms in hospitals. That's very, very expensive. That translates into higher insurance rates for everybody. Isn't that true? And so the long-term control of costs for society generally revolves to some extent around how we handle this issue. Secondly, the workforce, having people prepared for the workforce, these kids I talked about earlier, that's very real. You know, whether they grow up to be able to function in the workforce is a very substantial question. And finally, because this involves such a great component of mental care, with respect to mental care, there's a component that's not measurable exactly, but much of what we call crime, a substantial portion of what we call crime, you know, and I'm not sure we should refer to it that way in the sense of personal responsibility in cases where people can't control their own behavior. But things that we identify as crime and we throw people in jail for, to the extent that those interactions with society are a result of depression and unstable mental conditions. Not even mentioning the exaggerated and isolated cases of real broad violent criminal behavior that we've seen in the country from time to time that has come from persons who have had mental illnesses. What is the value to society of picking up on those problems earlier and these people knowing they have help instead of acting out in violent criminal ways and hurting families and hurting children and burdening our jail system, et cetera, et cetera. The whole legal system becomes bogged down because this element is a part of it.
Any other questions before we conclude here? Kim? Yes. One more, Lori?
I just feel compelled to say there's we've recognized a lot of people in the room. The one person we probably haven't recognized that needs to be is Todd Reckling. Todd has made, I can't count the number of trips back and forth, and been very much integral in there. I want to make sure that that's publicly stated. So thank you, Todd.
Thank you, Todd. Anything else? Well, thank you all for joining us here today. We appreciate your support and looking forward to a very exciting times ahead. Thank you.
Great.
Good job.
Thank you.